Good afternoon, everybody. Thanks for giving us a little bit of your time. We're here today to talk to you about the MAP Handbook education. So to give you a little background on why we're here, let me first start with what the MAP Provider Handbook actually is. The handbook is intended as a resource, an educational tool for safety net providers and their referral staff to understand the ins and outs of how the MAP program works. It was previously available in print, but is now solely an online publication. Don't worry, we're going to give you a demo of this online resource in just a few minutes. The Provider Handbook includes everything from claims and copayment information, services that require prior authorization, eligibility office locations, and a list of MAP contracted providers. It also includes information on pharmacy services and specialty care referrals. Today, we'll be focusing on that last thing on the list, specialty care referrals. In January of 2018, we realized that the specialty care referral guidelines no longer reflected current provision of services. In fact, many of the specialty care service guidelines hadn't actually been updated in over 2 years. Doctors Wolf, Brown, and Rogers, other designated specialty care provider champions, primary care providers, referral coordinators, and the CCC's project management office worked together to revise and standardize the structure of the referral guidelines, modeled off of Dr. Wolf's urology template. The project took several months, but by November of 2018, 14 guidelines were updated and 2 new sections were added, which you can see on this slide.
The specialty care referral guidelines for MAP patients are meant to assist primary care providers in the evaluation and management of conditions prior to referral. The guidelines now describe the difference between what specialty providers categorize as emergent versus urgent versus routine referrals, as well as conditions that probably are best managed in the primary care setting. You'll also see a section that describes the specific documentation required, such as labs, imaging, medication list, for scheduling an appointment, so that your referral to the specialist is as complete as possible. All of this information is particularly important because the CCC is moving towards e-consults in the near future. The new specialty referral guidelines will inform the technological component of the e-consult system, but will also inform you. Having a list of everything you need to submit for a referral at your fingertips will lessen the need for back and forth messaging between you and the specialist due to missing documentation. We're streamlining care for our patients by making sure that referrals to specialists are both appropriate and complete up front.
On this next slide, you will see the educational goals for this live stream event. Before the session is over today, we want to make sure everyone watching comes away feeling confident in how to access the online provider handbook and how to navigate the individual specialty guidelines. We want to make sure you can find the information you need to make a successful referral. One of the main things we did with this update is try to standardize the structure of the guidelines to have the same or at least similar sections, including urgent versus routine referrals and condition-specific requirements for referring depending on the specialty. We also want to make sure you have the general documentation, labs, imaging, and other testing results required for scheduling an appointment or referring for an e-consult.
Okay, now we'll show you exactly what this looks like. Make sure to bookmark this link on your computers for easy access. We're now going to link out on the video to the online handbook on the web. The first thing that you notice when we get to the main page here is that the provider handbook is searchable right there in the middle. It's a handy tool that we'll cover briefly in a few minutes. What we want to focus on now is the actual specialty care section. If you scroll down to the bottom and click on Show All, you can see these are the list of all the MAP specialty care service lines in alphabetical order. Today we're going to go over the urology guidelines. So we click on urology, and here's the standard format. We start with urgent referrals. This is a summary. The caveat, of course, explaining that patients with severe symptoms should be referred straight to the emergency department. This list of urgent reasons for referral should be applied to patients who are not in critical condition, but should otherwise see a urologist as soon as possible. These sub-bullets under each condition give more detail to determine urgency, as well as what tests to run to confirm the condition. If we keep scrolling down, now we have a brief summary of appropriate routine referrals. These conditions are relatively common and should be referred to urology for follow-up after the primary care evaluation and sometimes intervention. The next section is do not refer. And this is important because we really don't want to waste your time or your patient's time. This is a list of conditions that we really don't see in any given clinic, and for a variety of reasons that we could go over later. Maybe they should be seen someplace else, maybe they should be managed locally, or maybe, in fact, it's not a MAP-covered condition. Okay, now, finally, we have the documentation required for scheduling an appointment. Last but not least, all of the guidelines have a section about this. The documentation will vary depending on the service line, but a medication list as well as labs and imaging results will be pretty standard across the board. And then finally, detailed recommendations. And here we have the detailed recommendations about all of the entities that have been discussed above here. The idea is to give primary care providers more information about specific conditions and, importantly, measures to try before referring to the urology clinic, or hopefully trying to facilitate care in the primary care clinic by giving you a kind of a little mini consult, if you will. But if the symptoms persist and you go through these steps, then that is absolutely the right time to make the referral. Okay, now we're going to go back to the home page and scroll up to the search box. So here we are at the search box. And this is really a great tool that we can use to search by keyword and find the places within the MAP Handbook where that keyword is located. For example, we're maybe thinking about PSA screening in our patient. So let's type in PSA screening, hit search, and see what comes up. And yep, it's the urology clinic guidelines. And we can open that up, and at some point, if we searched on PSA using the Control F, you could find that again. But it actually can be even more useful when you're not sure where to refer a patient with a specific condition. So let's go back to this again. Let's say we have a patient and we're worried about a brain tumor, and we're not sure if that should go to neurology or neurosurgery. Fine. Type in brain tumor, hit search, and the first thing that pops up is neurology clinic. Let's see what that says. And actually, it turns out in the do not refer section, it tells you right then and there that brain and spinal cord tumors should be referred to neurosurgery. So very helpful. Okay, now we're going to go back to our slide deck.
What should you know now that we've given you a demonstration of the online MAP Provider Handbook? You should be able to accomplish all of the bullet points as noted on the next slide, including where to find the MAP Provider Handbook online, how to navigate to specialty care sections, how to search the handbook by keyword, and the general structure of the referral guidelines and how to utilize them to your advantage. Don't forget to bookmark the link so you can access the online version from anywhere at any time. I would encourage everyone to take 5 minutes or so to browse through the handbook and get comfortable with the format and the content. I think you will find it intuitive and very user-friendly and help to make the referral process go much more smoothly.
So thanks, Dr. Brown, and Dr. Rogers and Dr. Wolf as well. With that said, let me ask you guys a few questions that some of our audience might be having, and I'll start with you, Dr. Wolf. What exactly do you mean when we say do not refer? You talked about that piece when you reviewed your section.
That's a great question, Mark. I think it's important to know that we are still trying to be helpful, but what we're trying to say in this part of the specialty care guidelines is this particular clinic is not the right place for that patient to be seen. Where else should they be seen? What are the alternatives? There's really 3 alternatives, and the MAP guidelines often give you, or the MAP specialty care guidelines often tell you which it is. Number 1, and most commonly, they should see another specialist. So, for example, for the urology clinic, we're not the right people to send a patient with renal failure. They should go to nephrology. We're not the right patient to send with a rash on the penis. They should go to dermatology. So we'll often give that guidance. The second thing is we actually will refer you back to the instructions where that patient is actually better managed in the primary care clinic with the recommendations we've given. And third and finally, and not that often, but it does occur, sometimes it's not a MAP-covered benefit.
Makes perfect sense. One more, Dr. Wolf. What if I submit a referral that doesn't have all of the labs or the imaging complete?
That's a great question. And that's really important here. I think it's important that we flesh this out a bit. Those guidelines about required documentation are meant to facilitate your referral and, most importantly, facilitate the optimal care for the patient. If we know that a patient's going to need lab X and radiology Y, if we know that's going to be essential for that diagnosis, it makes all the sense in the world to get those before they're seen, because then they only need to see the specialist once and not twice. But we also don't want those to be barriers. If you really feel, I really want Dr. Rogers to see this patient, and I really don't think he needs that Holter, fine. Send them on. Dr. Rogers will review it, and then we'll make a judgment at that time.
Great. So, Dr. Rogers, what if I do something, what do I do if something on the routine list? I think I have a patient who is listed as the reason for referral lives under the routine section of the referral guidelines, but I think it's important and I want to refer to the specialist right away. How should I approach that?
Right. Well, that's something that certainly does come up all the time, and that the handbook is great in giving us guidelines, but it's certainly not meant to be a barrier or to interfere with clinician judgment. So that if in the judgment of the clinician the patient needs to be seen more urgently, by all means reach out to us. And there's a couple of ways to do that. One is if e-consults are available, that's one avenue. If not, one can contact a number that will be provided from Community Care Collaborative so that we can route that and expedite that request.
So thanks, Dr. Rogers. So, Dr. Brown, probably the hardest question I'm going to ask today, and it's going to take us out here. If I have a question about these guidelines, if I have a question that I need to direct to a provider, what do I do with that? How do I move that forward?
Well, that's another good question, and we anticipated that this might be asked. And in reality, before today, we did not really have a good answer. And as we prepared for this live stream event, we decided that we would create a form and put it on the CCC website where questions or concerns could be submitted, and then that will be triaged and fielded by the CCC Medical Management Department, and then triaged again to the right provider or person to answer that question.
So thanks for that, Dr. Brown. I'll add a little bit to that. So it's been alluded to in this conversation that we're moving towards what we call an e-consult strategy. Basically, your opportunity as a primary care provider to direct a question to one of our specialists along with the appropriate clinical information and hopefully get your answer back for your patient without the patient actually needing to go see that specialist. When that platform and that strategy gets fully implemented, I think communication between primary care providers and specialists is going to be much more seamless and just a regular part of your workflow. What Dr. Brown was talking about is our interim solution. It's the way in which we're going to help facilitate communication around these guidelines and around your particular patient issues until we can get a much smoother, direct relationship established between all of you out there doing primary care on behalf of our patient population and our specialists. And so we're about out of time for this virtual event, but this video recording is going to remain available for you to view at your convenience right here on YouTube. Sarah Septon, the CCC's project manager for this particular initiative, is going to be sending out a direct YouTube link to everybody later this week for you to bookmark, along with that very important link for the MAP Provider Handbook somewhere on your browser window. I'd ask all of you to feel free to pass the information about this education and the MAP Provider link to any of your colleagues who might not have had the opportunity to hear about this, weren't able to know that this event was occurring. We want to get this widely disseminated throughout all of our primary care clinics because we believe this information is really going to make your job easier in taking care of your patients. We thank you so much for your time, and we hope you have a good rest of your afternoon. Thanks.